Cluster headaches are known and called suicide headaches because they are one of the most painful forms of headaches known to man. Being different from migraines and tension headaches, cluster headaches have a distinct set of symptoms that make them mysterious but devastating. Any patient who experiences a seemingly inconceivable, debilitating headache must be empowered to know that such a symptom may herald a diagnosis that allows for management. Sign 7. Intense, one-sided pain. The most characteristic feature of the pain from a cluster headache is a severe, sharp pain on one side of the head that seems nearly unbearable. It can only be described as a stabbing or burning feeling, as if some hot poker had been inserted into the eye or temple. Not at all like migraines that can present with pain around the head. Though typically pulsating, the headache in cluster headaches affects just one side. Generally, it occurs near the eye, temple, or even the forehead. The sufferer finds himself unable to remain in one position due to its severity. This pain, researchers think, is caused by the overactivity of the hypothalamus, a section of the brain that deals with sleep and biological rhythms. The mechanism is not fully understood, but the outcome is painful. Many victims describe attacks of cluster headaches as the worst pain they have ever endured, leaving them in a helpless state. The condition is so severe that some people have labeled it suicide headaches, indicating how much care and understanding is needed. Sign 6. Red and watery eyes. Cluster headache could be at fault if, during one's headache, one or your eyes turns red and watery. This is the most obvious form of a physical symptom of such headache, usually on one's painful side. Cluster headache excites the autonomic nervous system that has control of those functions, not under our volition like tear glands. The excessive activity of these has brought redness with lots of tears in this one eye. This symptom often is confused with conjunctivitis or allergies, leading to delayed proper diagnosis. Note that the redness and watering only occur during an attack. Knowing this symptom can help distinguish cluster headaches from other types of head pain and guide sufferers toward the right treatment. Sign 5. Nasal congestion or runny nose. Another weird and often neglected cluster headache symptom is nasal congestion or nasal drip, which occurs unilaterally on the affected side. The autonomic nervous system is also involved, as it causes swelling of nasal passages and the production of mucus during an episode. This results in a stuffy or dripping nose, such that patients believe they have some sinus condition. Many patients with cluster headaches initially assume that they have sinusitis, especially if attacks occur seasonally. But severe head pain as an accompaniment puts cluster headaches apart. Strong indicator that it is likely a cluster headache and not a simple cold or a sinus condition if nasal symptoms are present with intense unilateral head pain. Sign 4. Restlessness and agitation. Cluster headaches do not just affect the head, they also affect behavior. During an attack, sufferers often become extremely restless and agitated. Unlike migraine patients who wish to lie down in a dark, quiet room, cluster headache sufferers have been seen pacing, rocking, or even banging their heads against a wall in an attempt to distract themselves from the pain. The pain is so intense that even the slightest discomfort triggers an automatic fight-or-flight response that makes it impossible to even sit still. This restless behavior is a characteristic signature of cluster headaches. Even the restlessness is tormenting, and the headache sufferer cannot do much to stop the pain. And this can, over time, result in anxiety and depression. This calls for medical support, accompanied by emotional care. Sign 3. Droopy eyelids. Another subtler but equally revealing sign of cluster headaches is ptosis, or drooping eyelid, on the side of the pain. The severe pain and nerve stimulation involved in cluster headaches can temporarily paralyze the muscles controlling the eyelid. This symptom is certainly not the most prominent. However, it is something that doctors look for to diagnose the condition. This also explains why cluster headaches are more than just a pain disorder. They disturb many functions of the body. The drooping typically reverses once the attack is over, but it can be disturbing to experience for the first time. Sign 2. Preemptive timing. They are referred to as alarm clock headaches because of this uncanny ability to affect the same time of day or season. Cluster headache is believed to involve an abnormality in the brain's biological clock, namely the hypothalamus. This connection explains why they often occur during sleep or follow a strict daily schedule. Many patients experience the worsening of their headaches in spring or fall, which could be caused by changes in light exposure or barometric pressure. Predictable timing may allow victims to prepare for attacks, but also instills fear in them, knowing exactly when the pain will return. Sign 1. Short but repeated attacks. Unlike migraines that can last hours or even days, cluster headaches are relatively short but occur several times during the day. Each attack lasts from 15 minutes to 3 hours. But the wretch may experience up to 8 attacks a day, leading the sufferer to feel that the pain never ends. Cluster headaches occur in clusters. This means the sufferer endures daily attacks for weeks or months, but then enters remission when the headaches disappear entirely. Attacks may occur at any time with a frequency and intensity of attacks that make cluster headaches one of the most disabling headache disorders, often interrupting work, relationships, or regular life. The cause of cluster headaches is not well determined, but experts believe the syndrome stems from a combination of genetic, neurological, and environmental factors. This complexity makes them difficult to predict and treat effectively. Its most interesting feature is the association with the hypothalamus, a small region of the brain responsible for many very important functions such as sleep, circadian rhythms, and hormone production. Evidence exists that this portion of the brain is hyperfunctioning in patients with cluster headaches and accounts for the fact that these attacks are so tightly timed and cyclical. Overactivity in the hypothalamus might explain why these headaches frequently happen at the same time each day or during certain seasons. This adds another level of complexity to the mysterious nature of these headaches. There are also known triggers for cluster headache episodes that may occur during an active period. Alcohol is one of the most common culprits, and even small amounts are often enough to bring on an attack. In addition, there are strong smells like perfume or gasoline, high altitudes like in air travel or mountain trips, and even shifts in weather patterns that may trigger such debilitating headaches. For many patients, identification and avoidance of such triggers are a key part of managing the condition. Cluster headaches are more common in men than women, usually starting between ages 20 and 50. The reason men are affected more remains unclear and continues to be studied. Cluster headaches are less common than migraines or tension headaches, but their intensity and frequency make them uniquely debilitating, requiring greater awareness and care. Exactly how cluster headaches occur is still unknown to date, but experts say that they may come about due to a combination of both genetic, neurological, and environmental factors. The integration makes cluster headaches unpredictable and uncontrollable. One of the focal points areas for researchers to pay particular attention to would be the hypothalamus, which is a little piece of the brain and serves various important functions. Some individuals with cluster headaches report abnormal activity in their hypothalamus, which is part of the reason their pain cycles often follow some semblance of a pattern, many of whom go on the attack at more or less the same hour daily, or even have more predictable seasonal attacks. Certain things are known to trigger cluster headache attacks during an active phase. Alcohol, for example, is a common trigger, and even small amounts can bring on an episode. Strong smells like perfume or gasoline, traveling to high altitudes, and changes in the weather can also set off attacks. Knowing what to avoid and learning to recognize triggers is a huge part of managing cluster headaches. Cluster headaches affect males much more than females, and the usual onset time is between 20 to 50 years of age. Not as common as migraine attacks, cluster headaches are among the most severe and interfering. Researchers are currently learning about why they occur and what factors may lead people to experience them more so than others. Cluster headache, despite being an apparent physical disease, leaves its mark mentally too. Anxiety and depression. It can feel hopeless when one does not know how and when another attack may occur. Support networks. Creating such a support network of loving friends and family and competent care providers can make a real difference. Advocacy and education. Informing other people about the disease can lessen the stigma attached to it so that they receive compassion. Cluster headaches are a complex and often misunderstood condition, but recognizing the signs can lead to faster diagnosis and better management. From intense one-sided pain to strange symptoms like drooping eyelids and nasal congestion, these headaches challenge both sufferers and medical professionals. If you or anyone else feels these symptoms, don't hesitate. Reach out to a doctor and consider some treatment. Together, Let's shine the light upon this painful condition and bring hope to all who are going through it. Thanks for watching. If you found this video helpful, be sure to like, subscribe, and hit that little bell icon for more content.